Hi, I'm Frank Diamond, the managing editor of Infection Control Today, where we are helping those on front lines of infection control and prevention beat back one of America's greatest challenges ever, COVID-19. The White House Task Force on the Coronavirus says that the disease will kill anywhere from 100,000 to 240,000 people in this country, and that's if social distancing guidelines are followed. President Trump yesterday announced that those social distancing guidelines will be in effect until April 30th, and experts on the task force believe that the guidelines appear to be helping. Meanwhile, Johns Hopkins University says that there have been more than 189,000 COVID-19 cases and over 4,000 deaths in this country from COVID-19. Johns Hopkins says that the coronavirus is on track to be the worst outbreak in the world, eclipsing even that which occurred in China, which was the epicenter of the disease. COVID-19 has invaded all 50 states. Infection preventionists, environmental services crew, hospital administrators, procurement teams, doctors and nurses, and all others working in hospitals, they are literally holding our society together at the moment. Healthcare officials say that they are in desperate need of N95 face masks, and President Trump has evoked the Defense Production Act to ask General Motors to make more of them. General Motors is in fact making more of them. Meanwhile, the Food and Drug Administration just approved a machine that the makers say can decontaminate 80,000 used masks a day. You can bet that healthcare officials are keeping a close watch on this. Op-eds in the New York Times and the Washington Post and other places have called for the public to have greater access to the face masks. And now the CDC is reviewing its policy on face masks in light of the large degree of asymmetrical carriers among us. To read these and other developments, please follow us at infectioncontroltoday.com. Hi, I'm Frank Diamond. I'm the managing editor of Infection Control Today, and I'm here with Dr. Kevin Cavanaugh. Dr. Cavanaugh is a frequent contributor to Infection Control Today, and he has been following the COVID-19 crisis very closely. Dr. Cavanaugh, what are the findings that the CDC is going over now? Anything new about how contagious COVID-19 might be?
Well, yes, the CDC released some very concerning statements today and confirmed really things that I have been very concerned about and that I have suspected. One is that COVID-19 is 3 times as infectious as the flu. And this is very concerning. That would put an R0 of approximately 4.
Right.
The other is that 25% of those infected may be asymptomatic carriers. And this, of course, would result in a greater spread of the virus. And that of those that develop symptoms, they may be infectious for up to 48 hours before those symptoms develop. The LA Times also had an article that recorded a choir recital of 60 people that were doing social distancing, and 45 of them came down with COVID-19. 3 were hospitalized and 2 had died, and that gave rise to the possibility of asymptomatic spread. So this virus is highly contagious, and having adequate PPE is extremely important. And it also underscores the need for having adequate testing and a rapid test, because you're going to have to find out in ideally minutes whether or not someone is infected and carrying the virus. You cannot tell by whether or not they have symptoms.
There's been talk, I know there's an op-ed piece in the New York Times and in the Washington Post about giving the public more access to masks or encourage them to make their own homemade masks. Even though there's a little bit of debate about how effective masks will be against COVID-19. Any thoughts about that?
Well, my opinion is it is probably better to err on the side of safety. Now, they are not talking about the N95 masks for healthcare workers. What they are talking about is what's called the DIY or do-it-yourself masks that you can make, And one of the things I feel the CDC should do is have guidelines for the public to do this. If you notice that in Southeast Asia, and you look at the videos, it's very common for people to be wearing cloth masks. And there is some evidence that this will decrease transmission. I think it may not protect the mask wearer as much as it does the other person. Because remember, you could be spreading the virus and not even know it. And so that is important. And the other thing a mask will do is prevent you from touching your nose and your mouth. It kind of reminds you to not do that. And it's very common for that to take place. And so a mask will help to protect that mode of transmission. So it may only decrease the transmission a little bit, but every little bit helps, and that may be a critical amount that's needed to break this epidemic. So yes, I am in favor of that, but would caution that the N95s need to go to the healthcare workers first. One of the things the public does not understand is that N95s can be difficult to breathe through. They're very difficult to wear all through the day. And even if you notice some of the pictures that you see from Southeast Asia, the people that have N95s oftentimes have them over their mouth and not their nose, which of course makes them next to useless.
Right. Well, what about the eyes too?
Well, the eyes are also a problem because you can still get transmission through the eyes. And so even if you wear a mask and you're part of the public, you're not going to have any guarantee that it's going to protect you. Social distancing is by far the best way to protect yourself. Either stay at home and stay at least 6 feet, if not more, away from individuals. Healthcare workers need to have on full personal protective gear. That includes goggles, it includes gowns. If they have a disposable hazmat type of a jumpsuit, that would be great. And of course, N95 masks. And until a rapid test is developed, it is extremely important that they wear this on almost every patient that they see, because you cannot tell who is carrying the virus and who is not. Asymptomatic spread may result in 50% of the cases.
But there's not enough masks to go around, as everybody knows at this point.
No, there is not. And that's one of the critical shortages. And the CDC has issued guidance that if you run out of masks, to do extended use, to do reusing, and at the last resort, they've even mentioned bandanas. And I'll be honest with you, I've never been taught that in medical school. It's like being in a third world country. We certainly should have had supplies of these in the strategic stockpile. The hospital should have had ample supplies of these. These epidemics have been occurring every 10 years. We've been lucky to miss them, but certainly this is something that should have been expected and we should have been prepared for. There is also a company which I believe is Critical Care Decontamination Systems, that is making a unit that can decontaminate masks and gowns, and this would be a game changer on providing more personal protective equipment.
Right, we wrote about that in Infection Control Today the other day, Ohio-based company, I believe. And have you looked into what they're doing, and what do you think?
Well, I think it could be a game changer. And I think that it's very important to see how the system works. And of course, it's not just decontaminating the mask, but you also have to be careful of the straps and the attachments, which may be a little bit different between products. But certainly, if I had a choice of reusing a mask versus using a mask that has been re-sterilized, I would choose the latter. It needs to remember that healthcare workers are exposed to a tremendous viral load that puts them at great risk for both developing the disease, and when they develop it, they may well develop a more severe form of the disease. So their protection is of utmost importance, and we need to do everything we can to prevent them. They are truly frontline workers, and they are truly heroes.
You've been a voice of warning since this first broke, saying all along that this is serious, serious, serious. So now I guess I've got to ask you to be a voice of hope here. When do you see this easing up? When do you see us going back to a normal life?
It's going to, I feel, be many months. Right now, the experts are talking about a second wave, which could possibly occur in the fall. We wrote an article in Infectious Control Today, which talks about when we will have won this war. And really, it's when we become prepared, when we have the proper equipment, the proper testing. if you're going to go up to get a takeout meal, that people are wearing gloves and masks, and that they've been tested, maybe even that morning before coming into work, to make sure they're not carrying the virus. And of course, you do hope that you can get a vaccine, but development of a vaccine may be a year to a year and a half away. We need to get back to a normal life before that, but certainly we need to get a healthcare system that's ready, that is beefed up, and we need to have the proper supplies before we go on ahead and do this, along with testing. And testing is important, and these supplies are important, not only for healthcare workers, but for delivery workers, for grocery workers, to get our system back on so that we can cope with these epidemics.
I know you've written for Infection Control Today about ACE inhibitors and how there is possible evidence, or there's evidence that there's a possibility that ACE inhibitors might exacerbate COVID-19 symptoms, and that's possible one of the reasons that older people are more susceptible to it.
Well, this is a concern. It is a very debated concern, and this is just laboratory. Certainly, I would not discontinue your ACE inhibitors if you're on hypertension. It's very difficult to transition to a new blood pressure medicine regime. They're not sure of this, but if I was taking an ACE inhibitor, which actually I am, I would suggest being very careful with the social distancing. You want to have strict isolation procedures. I would be staying at home, being careful not going out in crowds, because you may be at an increased risk. But you'll be at much more of a risk if you suddenly come off your blood pressure medicine. So don't do that. But there are some steps you may want to take to be a little bit more conscious of this. And of course, you always are going to need to consult your primary care physician or your doctor before doing anything. It is my hopes that, well, if this is positive, maybe they can come up with a cure or a therapy to try to prevent viral entry and mitigate these symptoms. But certainly you don't need to have people that are getting strokes at home for coming off the medications. That's not the importance of the message. But no one's ever died with performing strict social distancing. So certainly people should be doing that.
Infection preventionists who make up a good portion of my readership, they're on the front lines. Any advice you want to give to them?
Well, your heroes, I would make sure that you wear the PPE that you have, be safe, and as much as you can, be actively engaged in getting PPE for your institution. Currently, it's difficult to do. There is not a coordinated national system. The states are bidding against each other. Prices are going out the roof. It's ridiculous. It's similar to having armies in World War II being mustered in every single state, and then having the states competing against each other, bidding for the guns and the uniforms. No one goes to war under that system. So we need to have a strong, coordinated national system. And that would be extremely important for infectious preventionists and for the healthcare community to start engaging in. Because a lot of the problems that we have now on getting the equipment has to do with the procurement process. Granted, availability is a problem, but so is the procurement process.
You've been watching this, again, unfold since the beginning. You've been sounding the alarm since the beginning. Is there an example that you can name of a region, country, area that's handled this the best as far as you can see?
Well, right now, Southeast Asia has, whether you look at Singapore, South Korea, China, where they had a uniform system, had social isolation, locked down the country, and got over the epidemic more rapidly than what we are doing right now. The problem is that this is a worldwide problem, and we all live in the same fishbowl. They're going to have problems with the virus being reintroduced into the society. With an R naught of 4, that's assuming this is 3 times as infectious as the flu, a very high degree of the population, possibly 75%, would need to become immune to this virus before we would have effective herd immunity, or when the society could say, well, we've got this epidemic whipped. But as a caveat, you need to remember that viruses out there continue to evolve, And similar to MERS and SARS, 10 years from now, we may be faced with another one. So we need to learn from how we handled this epidemic to where we're starting to institute strict procedures when the caseload is maybe 10 rather than in the tens of thousands or hundreds of thousands of individuals.
Doctor, thank you so much for your time. Any final thoughts about COVID-19 in general and where we go from here in general?
Well, I think we really do need to take a look at our healthcare system on whether or not a fragmented system that has been running lean on staffing and equipment is one which we can tolerate. Maybe we need to change the way we deliver healthcare. And I think infection preventionists need to be on the forefront of that debate. And please stay safe.
Thank you. Dr. Kevin Cavanaugh, a frequent contributor to Infection Control Today, and I'm Frank Diamond, Managing Editor. Thank you for tuning in. Thank you.
Thank you, Frank.